Schizophrenia affects about 1 in every 100 Australians throughout their lifetime. The condition is characterised by altered brain and thought patterns, and if left untreated, it can be fatal, with a death rate of 2.5 times that of the normal population. With so many people affected by schizophrenia, and with such serious consequences, it is imperative that we find a safe and effective treatment. At present, schizophrenia can be managed with antipsychotic medication. However, these can come with serious side effects. These side effects are often caused by a lack of dopamine, as the majority of antipsychotics act as dopamine blockers. We have recently discovered a new compound known as garvinact that could potentially be a more effective treatment. Clinical trials have so far shown a positive outcome to the treatment of schizophrenia with garvinact. Garvinact is being marketed as Garvinact and could potentially benefit thousands of Australian people affected by schizophrenia. You will now hear from our head biologist who will explain more about schizophrenia.
Schizophrenia is a mental illness affecting the normal functioning of the brain. This alters the person's ability to think, feel, and act. The illness affects an astounding 1 in 100 people. The causes behind schizophrenia are not fully understood. Although it is believed that it is due to hereditary, some people are born with a predisposition to develop this kind of illness. Certain things in a person's environment, such as stress or the use of drugs like marijuana, can trigger the person with a predisposition to the illness to develop schizophrenia. It has also been identified that people with the illness have a higher level of dopamine than the average population. There are 2 different types of symptoms associated with schizophrenia. The first are identified as positive symptoms, as the person's experience of their senses are amplified. One of the most commonly experienced is auditory hallucinations. This is when the person hears noises, most commonly voices, which aren't really there. They can also see things that aren't there, and commonly find regular lighting blinding and unbearable. Another positive symptom of schizophrenia is delusions, when a person has bizarre, false beliefs. These can be minor or range to extreme paranoia. The second category of schizophrenic symptoms are negative symptoms, when thoughts and behaviours which are normally present in the general population are suppressed. This includes being less emotionally expressive, having a lack of motivation, and a lack of ability to experience pleasure. These symptoms do vary greatly from person to person, both in pattern and severity. While such behaviours can seem so extreme and irrational, it is important to note that these experiences are 100% real for the patient, which, as I am sure you can imagine, would make day-to-day living extremely difficult. While there is no current cure for the illness, development of more effective drugs are so important, as for many patients it is the only way to allow them to live a functional life. It seems that Garvinact will allow patients to live this functional life more efficiently. I will now pass you over to our pharmacologist, who will discuss Garvinact's unique mechanism of action.
As our biologist mentioned, at the moment the specific cause of schizophrenia is unclear, though scientists have found that schizophrenic patients have a higher level of dopamine than the rest of the general population. This is significant because dopamine is a neurotransmitter responsible for movement, learning, attention, and emotional regulation, which if there's too much or too little dopamine in the body, it can alter the way that we behave, think, and act, which is commonly a symptom of schizophrenia. Therefore, a way to reduce the symptoms of schizophrenia is to use antipsychotic medications. Most antipsychotics that are used to prevent and treat symptoms of schizophrenia all work in a very similar manner. This includes both first-generation and second-generation antipsychotics, which are also known as atypical or atypical medications. They work by blocking the dopamine receptors of the neuron. This blocking of the receptor reduces the amount of dopamine that's released when a neuron fires. Though blocking of the receptor causes a reduction or complete stop of symptoms of schizophrenia, it can have some serious negative consequences on individuals' motor functions and the reduction of motivation that is required to complete simple everyday tasks. This is where Garvinact differs from the competitors and other antipsychotic medications. Garvinact uses a naturally found compound known as garvinact, which is found in the acacia plant, which is easy to synthesize and into the medication. The compound garvinact does not block all the dopamine receptors like our competitors, but rather only a few receptors. This means that there is only a minor reduction in the dopamine release, but not that much of a reduction in dopamine that causes some of the common symptoms that are a result of taking other antipsychotics. At the moment, the trials that are being run on Garvinact in conjunction with other therapy are showing some very positive results without any serious consequences, such as an impairment on motor function. This will further be explained by a head of our development team, Cameron Smith.
Garvinact's schizophrenia trial is part of the clinical antipsychotic trial of intervention. The schizophrenia trial is being conducted to determine the long-term effects and usefulness of antipsychotic medication of individuals who suffer with schizophrenia. It is designed for individuals with schizophrenia who may benefit from a medication change. The study involves a new atypical antipsychotic medication. All participants will receive initial medical and psychiatric evaluation and will be closely followed through the study. For most participants, the study will last up to 18 months. Everybody in the study will be offered an education program about schizophrenia, and family members will be encouraged to participate. This trial consists of 1,600 patients suffering with schizophrenia from whom medical change may indicate for a reason of limited effectiveness or tolerability. All patients will receive some psychosocial intervention directed at improving patients' and families' understanding of the illness, the burden of the illness in the family, maximising treatment, minimising relapse, and enhancing access of a range of community-based rehabilitations. The trials will occur in 4 phases. In phase 1, 100 patients was randomly assigned to one of the 2 drugs, a placebo or Garvinact. It was determined that Garvinact can be administered once or twice a day. Initial dosing is generally 10 milligrams a day. However, if the dose is needed increasing, it should occur in the intervals not less than 24 hours in increments of increasing 5 to 10 milligrams a day, depending on the individual's tolerability. Although doses above 25 milligrams a day for twice a day were not demonstrated being more infectious than lower doses, dosing above 10 milligrams a day were associated with more symptoms and other adverse effects. It was generally not recommended. It was also determined that unlike previous atypical antipsychotic medication, Garvinact didn't induce a syndrome known as cognitive and motor impairment. However, other common side effects of Garvinact are dizziness, nausea, vomiting, increased salivation, constipation, and dry mouth. At the moment, all clinical trials have been very positive, and we're looking at marketing our medication to the public.
So in comparison to other antipsychotics, our drug trials have shown less serious side effects. With these findings in mind, the marketing team have projected estimations that Garvinact will make a revenue of approximately $5 billion in the first year alone, with a compound annual growth rate of 3.4% over the course of the decade. These estimations cover expected sales across Australia, New Zealand and the United States. And with continuous positive results through testing and feedback from individuals using Garvinact, we will then expand our medication to regions of Europe and Asia. One of our main focuses have been on the needs of our patients, unlike our competitors. This is achieved by Garvinact being available to hospitals and pharmacies under the Pharmaceutical Benefit Act. It will be proposed that within this Act, Garvinact will be available for $10 a prescription when purchased through a pharmacy or $50 through a physician's office, and will be covered by both private and public healthcare. With Garvinact being readily available to the public health systems and production having no major impact on the environment, we will lead to higher sales and revenue for our investors. So on this topic of production, Garvinact will stand above the rest due to how readily available our drug is. The harvesting of garperidone from the acacia plant is easily achieved without harming the environment, which is beneficial to mass production and distribution. Altogether, as everyone has been involved in the production of Garvinact has mentioned, this being the market researcher, the biologist, the pharmacologist and the development team, we will conclude that Garvinact is better than that of our competitors, not only because of the environmentally friendly harvesting of the compound and accessibility, but because there was a positive result found in the reduction of hallucinations without any major impact on motor functions. These results stand out from the rest, and with one a day, the voices will go away. Garvinact.